All right, we are going to be discussing on the pharmacology of the eicosanoids, and we'll be walking through with this outline the introduction, the mechanism of action, the four classes, the synthesis and drugs, and then we will differentiate what is COX-1 from COX-2, the biological effects, and then the pharmacological applications. Now, the eicosanoids are those substances that were derived from the 20 carbon unsaturated fatty acids. And usually these fatty acids we mean those that are from membrane phospholipids, the membrane of the different cells. All right. Now this is quite important for an introduction. Substances that were derived from the 20 carbon unsaturated fatty acids, and we said they are membrane phospholipids. Now, eicosanoids happen to be autocoids in nature, in the sense that they act around the cells in which that was producing them. That means if this was the membrane, let me say this is the membrane, and they were produced from this membrane, and we have the different eicosanoids. Now, the receptors in which they act on will likely be close to them. So we say also they act in a paracrine fashion. This is quite important to add for your knowledge. Now, for the mechanism of action, maybe let me show you. I have a cell like this. Let me show you a cell. Now, probably this is cell B. This is cell B. And then this is cell A. This is cell A that has produced the eicosanoid. Now, this eicosanoid acts on a receptor on cell B. If it acts on the receptor on cell B, we say it also acts in a paracrine fashion. By paracrine fashion, or it acts as an autocoid because it acts around the cells where it was being produced. It can act around the cells that was produced, or even act on the cell that produced it. Now, what's the mechanism of action is what we want to discuss now. These eicosanoids act on these receptors. Inside these receptors, they can either stimulate the G stimulatory coupled receptor or the G cure coupled receptor. Now, what happens with the G stimulatory receptor? G stimulatory receptor is going to increase or activate the enzyme called adenylate cyclase. Now, what will adenylate cyclase do? Adenylate cyclase is going to convert ATP to cyclic AMP. Adenylate cyclase converts ATP to cyclic AMP. That's the first thing I want you to appreciate. And then cyclic AMP is interpreted as second messenger. And then this is going to do a variety of things, which I'll tell you at a later time. Now, for GCure is going to stimulate the conversion of inositol 1,4,5 triphosphate, converting it to IP3 plus DAC. That is important. So it stimulates this particular step. The G cure, the G inhibitory stimulates the step where inositol 1,4,5 triphosphate breaks down to form IP3 and DAC. Now, what eventually happens, it is this DAG also that will interpret, and we are going to have the second messenger function. Now, the examples of second messenger function, as at this point, you can tell things like vasodilation, things like vasoconstriction, things like bronchoconstriction, maintenance of patent ductus arteriosus, things like a fall in gastric acid, uterine ripening, and the list goes on and on. The list goes on and on. So this is an overview of the different mechanism of action, either the G stimulatory or the G inhibitory. Now, for the four classes, what are the four classes of the eicosanoids? There are four of them. The prostaglandins, okay? We have the leukotrienes, we have the lipocoltins, and we have the thromboxanes. So these are the four of them that you should consider: prostaglandins, leukotrienes, lipocoltins, and thromboxanes. Now, prostaglandins, they were originally discovered from the prostate gland. They were originally discovered from the prostate gland. This is quite important to appreciate. Now, leukotrienes are the ones that have three conjugated double bonds. They have three conjugated double bonds. All right. Now, while lipoproteins are similar to leukotrienes, the only difference is that they have many hydroxyl group, many hydroxyl group. While thromboxane, like we said, are those that were originally. Now, leukotrienes also was originally discovered from the leukocytes. Now, how about thromboxane? Thromboxane was discovered from thrombocytes or the platelets, and they have a six ring that also has attached to it an ether. All right. So these are very important to appreciate that prostaglandins was discovered originally from prostate, leukotrienes originally discovered from leukocytes, and has three conjugated double bond in its structure. Lipoprotein has many hydroxyl group, and that is the only difference between leukotrienes from the lipoproteins, and then thromboxanes from this originally gotten from platelets and has a six ring attached to it with an ether. Now let's discuss the synthesis of the eicosanoids. The synthesis. Now for the synthesis of the eicosanoids, I'm going to really take out time to discuss a whole lot of things here. Now what will I discuss here? Number one, the whole story begins from membrane phospholipids, which I said before, membrane phospholipids. Now, what happens in membrane phospholipids? Membrane phospholipids will break down to form arachidonic acid. Now, arachidonic acid here, the enzyme that catalyzed this was phospholipase A2. Now, arachidonic acid on this side can go through two routes. The first route here will form what we call the hydroxy peroxide or the hydroperoxide. Okay, the hydroperoxides. While on this side, we will form an intermediate structure first called the endoperoxide. Now, what happens next? The hydroperoxides can then go through the routes of forming the precursor cells like the precursor substance like LTB4, LTC4, LTD4, LTE4. How about on this side? It can go through three routes. The first route here to form prostaglandin 2, which is also called prostacyclin. All right. On this other side, the prostaglandins E2, F2, etc. We call these ones the prostaglandins. And then on this side, we can form our thromboxanes. 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 Now, the enzyme that catalyzes this route is called the lipoxygenase enzyme. Lipoxygenase enzyme, otherwise called LOX. The enzyme that catalyzes this one is called the cyclooxygenase enzyme, otherwise called COX. Good. Now remember, this means phospholipase A2. Phospholipase A2. Now, this is another view of the whole synthesis. Now, can we talk about drugs that act at different places? Now, the first drug that could act here are the steroids. The steroids are the ones that act here, the steroids. The steroids are the drugs that act here. Okay? Now, but how do they act? They act on phospholipase, they inhibit phospholipase A2 by producing substances like annexins or even lipoproteins. And these substances will in turn inhibit phospholipase A2. So steroids, some other authors call it corticosteroids, same drug. Steroids or corticosteroids inhibit phospholipase A2 by activating or stimulating substances like annexins or lipoproteins, proteins like this, proteins like annexins or even the lipids like lipoproteins that eventually unanimously inhibits phospholipase A2. And none of these eicosanoid products will eventually be formed, none of them. Now, the second drug I want to talk about is the one that inhibits this COX. We call those family of drugs the NSAIDs. The NSAIDs. And for the NSAIDs, a good example, indomethacin, and ibuprofen. Now, indomethacin and ibuprofen, NSAID stands for non-steroidal anti-inflammatory drugs. Okay, indomethacin and ibuprofen. Now, these drugs are used to relieve pain, okay, and they're going to prevent the production of this. Now, what are examples of drugs that act here? COX-2 can be inhibited. Inhibition of COX-2 in USA is by a particular drug that we remember called celecoxib. Celecoxib inhibits COX-2 in USA. Now, we also have an irreversible COX inhibitor. Irreversible COX inhibitor. This one is a family of aspirin. Aspirin is a common drug. Irreversible COX inhibitor, aspirin. Now, we also have COX-2, COX inhibitor elsewhere. COX inhibitor elsewhere in other countries outside the USA. We have drugs like enterocoxib and what have you. Now, let me recap. At this point, I said membrane phospholipids formed arachidonic acid, and the enzyme that was inhibiting was phospholipase A2, which can be inhibited by which drug? The family of the steroids or what? The corticosteroids. And what were the things or how did they act? They acted upon by producing precursor substances like annexins and lipoproteins that could eventually go on to inhibit phospholipase A2. Now, arachidonic acid can go through this route or this route. I will stick to this route first. The enzyme here is COX, called cyclooxygenase. It is inhibited normally by a family of drugs called the NSAIDs. Examples, indomethacin and ibuprofen. And then I said specifically COX-2 in USA, the drug celecoxib. Then irreversible COX inhibitor, ENSA, aspirin. Then COX-2 inhibitor elsewhere or COX inhibitor elsewhere outside USA, we have the drug enterocoxib, even parocoxib. Parocoxib. Okay. Now you can see something here. Most of these drugs we have the COX, have the COX, have the COX. That will also help you in MCQs to be able to decode drugs that are in that route. Now on this side, a particular drug inhibits this one. And this one is the one we call xylitol. Xylitol. It has been used for the treatment of bronchial asthma. Xylitol. All right. Then the ones that we inhibit, all of these, either on their receptors or antagonize them, are the clasts. It will inhibit their actions on receptors. We call them likes of praniloclast, monteloclast, and the list goes on, but the N in M in clast. All right. So this has been the drug for the action or the synthesis of these eicosanoids. Now let's go to something different. Let's differentiate COX-1 from COX-2. Where have we seen COX-1? See COX-1 here. COX-1. This is COX, sorry. This is the COX here. So let's differentiate the COX. There are two COX. COX-1, cyclooxygenase 1, and cyclooxygenase 2. Are we there? Now for cyclooxygenase 1, watch. COX-1 is physiological, while COX-2 is pathological. That means it is released in conditions like inflammation and what have you. So since it's physiological, it is also called a housekeeping enzyme, a housekeeping normal function, like just like how the housekeepers are normally for the homes to care for the homes. Likewise, physiologically, for the normal functioning of the body, COX-1 is needed, but COX-2 is only released in pathological conditions. COX-2 is seen in organs like the brain, the bone, and the kidney. BBK, you may remember it that way. But COX-1 is seen, it is expressed in mature platelets. Expressed, it is the only isoform that is expressed in mature platelets. Take note of this for MCQs. This is quite necessary for your MCQ exams. Okay? Now, let's go to the biological effects. Biological effects. For the biological effects here, I'm going to be showing you here, and this is going to really take a lot of time to tell you. Now, what are the biological effects of prostaglandins? So I'll wipe all of this and I'll put it down here. So I'll do it in this way. The receptors again, or the receptors through which it can act biologically, we have prostaglandin E1, Okay, we have prostaglandin E2, prostaglandin E1, prostaglandin E2, prostaglandin F2 alpha, prostaglandin I2. Okay, what other prostaglandins do we have? We have the thromboxane A2, and then we have LTB4, and then we have LTC4, LTD4, LTE4. Good. So these are different receptors through which the prostaglandins or the eicosanoids can act on. Now, what will be interpreted by these different receptors? Now, the most simplest one here is this one. This one here is bronchoconstriction. Bronchoconstriction. All right. So any drug, any leukotrienes that acts on C4, D4, E4 are going to be interpreted as what? For bronchoconstriction. How about B4? B4 is the one that releases what we call chemo. It's a chemoattractant, and also activates. It also activates polymorphonuclear leukocytes. All right, polymorphonuclear leukocytes. Now, thromboxane 80 is the one that does, it increases. Remember where thromboxanes came from platelets. So it is going to help to increase platelets aggregation. It increases platelets aggregation. All right. Then, and also it will do bronchial constriction. Now, so I take it a little further. The only difference between I2, which is prostacyclin, and this is that this one great difference. This one will cause a fall in platelets aggregation. And let me take it from this side. Now, important again, this one here is useful for vasodilation. All right, is useful for bronchodilation, and is useful for a fall in gastric acid secretion. So look at this again. We have said E1, vasodilation, bronchodilation, and a fall in gastric acid secretion. LTC4, D4, E4, bronchoconstriction, B4, chemoattraction and activation of polymorphonuclear leukocytes. By polymorphonuclear leukocytes, I mean those leukocytes that have more than one nucleoli, something like this. A good example, e.g., neutrophils. So all these statements that you see here, polymorphonuclear leukocyte, a good example of it is neutrophils. Thromboxane, like I said, will increase platelet aggregation and will cause bronchial constriction. Now let me come here. E2 will do everything we see in E1 plus number one, it will cause what we call maintenance of patent ductus arteriosus. All right. Number two, we have pain sensitization. Number three, we have it causes fever, it stimulates for fever. Number four, uterine contraction. And then number five, cervical ripening. All right, these are things you need to note. Now for F2 alpha here, one of the most important things is that it is going to increase aqueous humor. It will increase the drainage of aqueous humor drainage. Okay. I2 will cause what we call pain sensitization, and will cause maintenance of patent ductus arteriosus. Right. Now, this one here will cause bronchial constriction. All right. So these are basic things I feel you should know. You can look at them again, and from time to time, you get to review them as often as you can. That will really be of help to you. Now let's look at the last but one concept, pharmacological actions, and then we are done. The pharmacological actions. Okay. Now for the pharmacological actions, I'll be telling you how our knowledge of all of these receptors and its actions has been used for the production of drugs, or how our knowledge of how drugs act has been improved. Now there's this abbreviation you get to know here. You remember Abel, and then you remember C, then double arrow, and then an I, then double P, and then double G. So something like this, able creep, P square, G square. So this is something I want you to note as the abbreviation for the pharmacological applications of eicosanoids. Okay. Now let me write each of them and what they mean one by one. Our knowledge of eicosanoids has been used for abortion. For abortion. You remember when we talked about things like uterine contractions, cervical ripening. So abortions around the second, even in the third trimester, has been applicated, and there have been drugs that have been made that are likely useful for what? For abortion. Okay? The B here tells me Bartter's syndrome. Bartter's syndrome. Bartter syndrome is a condition where the body produces excess amount of prostaglandins, e.g., prostaglandins E. So that's also another knowledge where we have been able. So when we make drugs that can be able to inhibit the synthesis of prostaglandins, it means we have been able to also treat conditions like what? Bartter's syndrome. E here tells me about erectile dysfunction. Erectile dysfunction. For erectile dysfunction, we can give drugs that can cause vasodilation. And vasodilating drugs, you can tell me what will happen. They are going to cause the penis to erect again, and then can also perform its function. Good drugs like that are the drugs like aprostadil. Aprostadil has been given with or without papaverine, or some people have even given it with phentolamine. Phentolamine. All right. So erectile dysfunction. E. Now, it is given intra-urethra. That means with the tip of the penis, and then where we normally would have passed a catheter, we insert the drug there. Then for L here, for labor. For labor. Okay? Remember, there are drugs also that can be made to act on the uterus to cause uterine contraction and cervical ripening. Now, CVS here, for this, it has been used to treat conditions like pulmonary hypertension. All right. Now, for arrow here, we have the rheumatoid arthritis. The rheumatoid arthritis. Rheumatoid arthritis. And by rheumatoid arthritis, we mean drugs that prostaglandins drugs are being used as an adjunct. Because in rheumatoid arthritis, there's pain and there is active inflammation. So any drug that could be able to reduce pain, like the NSAIDs there, we can talk about them. Then the other arrow here, respiratory. For respiratory, we have mentioned different drugs like xylreton, like the family of the class, and all of that, because these drugs were used to treat what? Asthma, right? I here for inflammation. I here for inflammatory conditions. The NSAIDs will work here anytime, any day. Now, P here reminds me of peripheral vascular disease, PVD, or patent ductus arteriosus condition. We can also use alprostadil here. All right. Now, for this other P here, I remember platelet aggregation. Now, a good drug here is low dose aspirin. Low dose aspirin has been implicated for platelet aggregation drugs. And then lastly, G here for glaucoma. For glaucoma, we have the bimatroprosts, okay, and a whole lot. They have been used to treat glaucoma. Using which receptor? You remember the PGF2 alpha and how it increases the drainage of aqueous humor. And then GIT, we have the drugs of misoprostol. Misoprostol has been used to treat ulcers which were NSAIDs-induced ulcers. NSAIDs-induced ulcers. Please remember that. All right. So this has been an overview of the different pharmacological actions of eicosanoid. So you can go through this over and over again and make the most out of it. Please endeavor to, if you have come to this point, endeavor to like, endeavor to share, endeavor to subscribe, and leave a comment there in the comment section. I'll be willing to answer all of your questions concerning the eicosanoid pharmacology. Thank you.